We're now going to go through the structures you need to learn for your practical that are under nerve list, cadaver. The first structure you're going to be responsible for identifying are cervical nerve roots, and then in parentheses next to that structure it says C5 to C8. So I just wanted to start out kind of showing you the spinal cord with the nerve roots and some of the plexuses that are created as these spinal nerves work away distally from the spinal cord. So here we see a posterior view illustration showing the spinal cord and the spinal nerves on the right and the spinal nerves on the left. Now, the spinal nerves on the left would extend distally in the same way that they do on the right, but for ease of simplicity of this illustration and so we don't get confused, they're just showing them on the right. So if you look up here, so cervical nerve roots, so remember that the cervical spine is this spinal region that is associated with the neck. The thoracic spine is that part of the spine that's associated with the upper back. The lumbar spine is that part of the spine associated with the lower back. And then the sacral region and the coccygeal region are down in kind of the midline buttock region, tailbone region. So if we look closely, we can see we have what are known as plexuses. So we have a cervical plexus, a brachial plexus, a lumbar, and a sacral plexus. As these spinal nerves at successive levels of the spinal cord, meaning C1 would be cervical spine level 1, C2 meaning cervical spine level C2, so far and so forth. As we get into the thoracic region, that C1 would turn to a T1, and then the lumbar region would be L1, so on and so forth. You can see that some of these spinal nerves, as they start to move distally away from the spinal cord, some of their fibers are going to blend with the neural fibers from nearby cord levels, and that's what we refer to as a plexus. So a plexus is kind of a blending together of neural fibers as those spinal nerves work distally away from the cord and toward peripheral tissues. So what that means is a particular nerve that, for example, may be sending information to and carrying information from tissue in a certain region of your body, the fibers in that nerve may be coming from various levels of the spinal cord. So that's what we refer to as a plexus. So we have a cervical plexus. We have what's known as a brachial plexus. If you remember, the word brachial or brachium refers to the arm. So this plexus here, this brachial plexus, is going to be a merging of spinal nerves that give rise to specifically named nerves that travel down the arm and carry information to and from the structures of the upper limb. If we take a look over on the right-hand side, we can see that brachial plexus very well, and I've outlined the cord levels from which these spinal nerves arise. So we can see up here is C5, C6, C7, C8, and T1. And at the beginning of those cord levels, when the nerves work distally away from the spinal cord, we call those spinal nerves. So this would be the C5 spinal nerve, the C6 spinal nerve, 7, 8, etc. Those spinal nerves, where they originate right off of the spinal cord, we refer to those as roots. So the emergence of those neural fibers as they move directly away from or distally from the spinal cord, we refer to those as roots. So this would be the C5 root, the C6 root, 7, C8, etc. So here we see roots, cervical spine, cervical nerve roots. Here we would see thoracic nerve roots. Here we would see lumbar nerve roots. And we can see that some of those roots, as they continue away from the spinal cord and become nerves, they're going to blend with nerves from other levels, forming some of these plexuses.